this video is over how bad it really is in Canada. You know, I met these two guys. This is going to be 2, maybe 3-parter. So you need to watch it. You need to see their interaction. You need to see how what they're saying really is going on in Canada. You know, they don't get to see what's going on outside of Canada. They only get to see what they're being told, which is kind of indoctrinating, you know, and you only get to believe what the government wants you to believe and see. That is not freedom right there. We take our freedom here in the United States for granted, and it's sad. But the video coming up, you're really going to see what's going on in Canada, and that whole free healthcare system is garbage. Garbage. The government intervening and schools not budgeting their own money is garbage. So these are 2 hardworking people, just like me and you. The video coming up next is 2 hardworking people that live every day in Canada. I met them here in Texas. It was the first time for them to ever be able to go out to a range. They talk about how bad Canada really is. You know, they only get to hear and see what the Canadian government wants them to hear and see. They don't get to see the world news. They don't get TikTok. They don't get things like that. You know, it's got to go through route. I mean, they're just not able to see those things. So we take for granted our actual freedoms here in the United States, which we are losing every day, people. And these guys are great, hard-working people. And I want you to watch these videos. I've always wanted to ask this, how is your free health care?
Slow.
Terrible.
It's slow.
Yeah,
Slow?
yeah.
It's slow.
Like, what are you talking about, like slow?
Like 3 months to get an appointment for non-emergency.
Yeah.
3 months for non-emergency? What about emergency?
You have to go to the hospital and then
4 to 8 hours.
You'll be in there 4 to 8 hours to get seen.
Yeah.
Even though, like,
unless it's like heart, then they might take you right away.
they might.
Yeah.
Yeah. But you're waiting.
Yeah.
What about like some kind of like surgery? I mean, you're still looking at 3 or 4 months. If you need like basic surgery.
You get pushed if you need a cancer surgery. You get pushed like 6 months.
Let's say my shoulder's messed up and I need to get surgery on my shoulder.
My mom and dad just had that done. That was 8 months before they got.
Before they could get a surgery, 6 to 8 months.
Yeah.
But if you have cancer and you have to have surgery, it's 6 months. They push you out 6 months.
You can be put out 6 months. Yeah.
So basically, they want to kill you.
Yeah. I know I wouldn't want to be sitting at home with it, living that for 6 months. No.
Yeah. That was just my question, because everybody talks about free healthcare here in the United States, but I wanted to. These guys are from Canada. They live there their entire lives, and that is coming from these guys right here about the Canadian free healthcare. Basically, it's shit.
Mm-hmm.
And do you have to see the doctor that they want you to, or do you get to provide?
You get the doctor you get.
Yeah.
So you get to see the doctor of your choice, or you get to...
So our doctor retired 3 years ago, and my wife and kids still don't have a family doctor.
Are you freaking kidding me? Is it because it's a wait list?
Yeah.
A couple 100,000 deep on the wait list.
To
get a family doctor.
To have a family doctor. So if you want to see anyone, you got to call like a hotline, and then they're usually over the phone appointments.
So like a teledoc.
It's a telehealth.
Yeah.
Telehealth. So how long is the average wait for somebody to get a family doctor if there's retired?
I wouldn't even know now.
Well, you're 3 years deep.
Yeah. I'm 3 years deep, and they haven't been contacted at all that we're anywhere close to the end of a wait list.
So what, I mean, like if you get pneumonia or something, you need to
go into
emergency.
emerge in the hospital.
And hopefully they'll see you, or will they see you?
Well, you'll get seen eventually, but you could be in there for eight hours before someone pulls you in and checks you out at all.
That's about what it is here sometimes. 5 hours, some wait times, you know. It just depends on where you're at. But the whole family doctor thing, I mean, you can't even get a family doctor.
No. I haven't seen a doctor in like 7 years.
Because of the free health care.
Well, just
or
yeah,
because
they're
it's just difficult, right?
I didn't know if like my doctor semi-retired, but he was doing like the phone appointments, and then he was away, on and off, whether he was working or not, because he was semi-retired, and then yeah, at least with him, he left us with someone, but my wife and 2 boys. Their doctor retired, and they didn't get anybody.
They didn't leave them with, and so they're just on a
So
wait
they
list.
go on a wait list, and
So
Do they get to choose their doctor at that point, or is it
No.
just like whoever
Whoever-
comes up when you're
Yeah.
when
Whoever's
your time's
in
at
line.
the top
Yeah.
of the list?
yeah.
So you get it's so once that is available, say they only have one position, you've got 2 kids, but they can't see all 3 of you. They're just going to take one kid.
Yeah, more than likely, yeah. Yeah.
Wow. And so your kids could actually have separate doctors
Yeah.
or pediatricians.
Yeah.
Well, hell, they're probably going to be adults by the time they get in a doctor.
Oh yeah, they will be. They will be.
So
I'm
basically,
trying to get them in with the doctor I just got given, but I doubt they're gonna take them on.
wow.
Yeah.
So
That's
it's
our
just,
free healthcare.
so it's just like, hopefully you get a doctor.
Hopefully you don't get sick.
Yeah.
That's it.
Yeah. I mean, seriously.
Yeah.
That was one of my biggest questions, is because you hear the Democratic Party screaming free healthcare, it's great in Canada, it's great in Canada, but we've never really known people, you know, because we're in Texas,
Yeah.
we've met a few, but I've never sat down and actually had a conversation with somebody and you know,
Well,
about the healthcare.
anybody that's well off, that's sick, they come here. Because they'll pay for it so that they can be seen.
So basically,
Because
healthcare,
in our country, you can't pay for it. They're not allowed to. They're not allowed to sell healthcare, right? Even if you wanted to be like, hey, I want to pay for it out of pocket just to be seen now.
so they won't even take payment.
No.
So it's just you are literally relying on the government for your
Yeah.
health care.
Yeah.
And because you're relying on the government, we all know shit gets messed up.
Yeah.
And that's basically
Your
you're,
life is on their time and not.
yeah,
Yeah.
you're just a number.
Yeah.
Wow. What about medical for the military? Is it the same way when you were?
It's a lot quicker in the military.
It
yeah,
is.
like we'll get seen like same day, same morning, and then preferential surgery times as well.
Okay.
But our military is pretty small, so we got to keep everybody ready to go. So
Okay. But then the everyday civilian, you're just on government time.
Yeah.
Well, like I said, I've never really.
And
asked
I
him.
mean, basically what happens is it's like anything government is where are they taking out of the budget, right? So they cut back in our healthcare. They cut back on the schools.
So when I
Like that's where we're paying our tax dollars to, but that's where they're cutting all funding from too.
so the whole free healthcare crap is a joke. See,
Yeah,
we've
our
done-
kids didn't have buses to school for the whole past month, so our workforce is like going to work late and leaving work early so that they can get their kids to and from school, because the government didn't want to pay the bus drivers. It was going to come out of the school budget. So
the government controls all the school budgets, not each school controls their own budget.
no.
Wow. So our schools control their own budgets here, but so the whole budget thing is the government runs it, and it just went shit. We all know when the government puts their hand into it, I'm the government, I'm here to take care of you, shit's gonna get messed up. God dang, that's bad.
Yeah, it's sad.
I'm sorry, guys. And when I post this video, you may blur out y'all's faces or anything.
all good.
for me, just because I'm ex-military, yeah,
Okay.
no face, please.
Okay.
Yeah.
And maybe because we work for government.
We're a government-affiliated company, so
Okay.
yeah.
It'd probably be
Yeah.
best.
Yeah.
I'll make sure I blur out y'all's faces, guys.
Appreciate that.
Cool.
I'll definitely do that because I'm not trying to put y'all out like that. We don't do that stupid
Yeah.
shit here.
Yeah.
Because We can tell our government to fuck themselves. Y'all can't.
Yeah,
Yeah.
true.
Oh, you talk bad about me, you're on the wait list for another 6 years. We're taking your doctor from you.
And we're here on work.
While we're on a work trip.
But we're government owned and contractor operated, right? But it's all government funded, so.
So your government.
We got, this is the shitty part, is we got our pension ripped from us. And we had no vote over it. The government just decided that we were no longer federal employees, even though, I mean, all the fundage comes from them where we work. And
When are y'all leaving back?
tomorrow morning.
Tomorrow morning.
What time?
5:30 a.m.
I started work up there to be like, hey, I'm gonna start here at 21. I got 35 years in, and I retire with a full pension. And now it's like, I have like 4 or 5 different pensions I pay into now, and that one just got kind of ripped away from us. And now it's like you work till 65 basically.
No matter when you start, you work.
Or you're taking 2 to 3% penalty a year every year before 65. And like, do you want that in your workforce?
No.
Right? Like, it's not good or healthy for your workforce to be working to 65.
Well, most of our retirement age here is 65, but most people can work 20 years and retire. You know, 20, 25 years. But I mean, our economy's gone to shit so bad that we have people coming out of retirement just to work to pay their fucking grocery bill.
Yeah.
Yeah.
So, what's gas? What's the price of gas up there?
About $1.50 to $1.70 a liter.
Is
A
that
liter?
US?
So it'd be about
Canadian.
$1.30 US a liter. So, I mean, we'd be paying close to $5.80 a gallon.
Yeah.
$5.80 a gallon of gas, and then Jesus, what's y'all's electricity bills like?
Ours is pretty good where we are because we're we're on our own grid. But like if you're OPG, Ontario Power, man, they're
Like, that's what I pay. We're about-
they're $200 a month probably.
What about milk?
Milk has gone to like $6.99 for 4 liters.
So a gallon.
It was,
$7 a
but I
gallon.
paid like my whole life. It was like $3-4.
It's gone up to
$6.99.
A gallon.
What about eggs?
What?
Paying
$4.99.
Yeah, $4.50, $5 a dozen.
$4.50 to $5 a dozen. Holy shit!
Yeah, bread's about that too. $5,
Yeah.
$4.
For a loaf of
$4
bread?
for a loaf of bread.
Holy crap!
Yeah.
Yeah, you walk out of the grocery store with like 3 bags, and it's $300.
Yeah.
See, our groceries are getting outrageous here, but I will when I post this. I just kind of want to let Americans know, because this is your first time to Texas, and this is your first time to shoot a gun. I actually met these guys in the parking lot of Perini's Steakhouse last night.
Fantastic steaks.
Great food. So now we're back because my phone died and I'm on my wife's. But I bet these guys last night, first time Texas, great food, great things. Of course, I've bleeped out some of the things they said because it had to do with where they work, things like that. We don't want to give Trudeau, Mr. Trudeau, any more ammo against these guys because we don't want their wait list to be extended for getting a doctor.